The Saskatchewan Health Authority Youth Mental Health and Addiction Services Department offers mental health and addiction treatment services to youth in Saskatoon, Saskatchewan. During the COVID-19 pandemic, the SHA quickly shifted from in-person counseling to counseling via text, telephone, or video call. This meant that youth could continue to receive mental health services during the pandemic. Given the importance of continued mental health support during the pandemic, the SHA asked youth and their families about their experiences, benefits and challenges of virtual care, and how these services can be improved for the future. They learned that virtual care was convenient, saved both time and money, reduced missed and canceled appointments, and allowed youth to reach out to their counselors when they needed support. In general, virtual care was a good alternative to in-person care. Although some aspects of virtual care were positive, it was often seen as less effective than in-person care. Distractions at home, a lack of privacy, as well as unreliable video platforms and internet connections made it more challenging to use virtual care. A lack of visual cues also hindered communication and relationship building between clients and counselors. These impacts were greatest among youth living in poverty, who may not have access to technological equipment and internet, and often experience crowded living conditions, and might find it difficult to develop trusting relationships with counselors. Counselors were not able to use some therapies and had to modify others to adapt to virtual platforms. A few recommendations were made in light of these findings. It was recommended that the format for delivering mental health care should be based on the needs and circumstances of each youth and their family. Better video platforms are needed to improve the quality of counseling sessions. Increased access to technology is needed to increase accessibility of virtual care for marginalized youth living in poverty. Finally, counselor training and a greater awareness of difficulties youth have in expressing themselves over virtual platforms can help counselors to understand and meet the needs of youth and their families. Learn more about the project by clicking the link below. If you have any questions or concerns about the project, get in touch with the researchers today.